In this section on gastrointestinal pharmacology, we will go over medications commonly given for gastroesophageal reflux disease and peptic ulcer disease. In this section, we'll discuss medications that are meant to treat gastroesophageal reflux disease. Gastroesophageal reflux disease, also known as GERD, and peptic ulcer disease are not only painful conditions, but they can cause long-term serious complications to patients. The goal of therapy is threefold: to protect the involved mucosa, to relieve symptoms, and also to prevent long-term serious complications such as intestinal perforation and esophageal carcinoma. Here we have some endoscopic photographs that show peptic ulcers that have stigmata of hemorrhage. And here you can see in this picture an actual jet of blood protruding from the site of the ulcer. Here we have a photomicrograph of normal esophagus, and you can see in this patient that they develop high-grade dysplasia as the esophagus heads towards the stomach. And here we can see an endoscopic photograph that shows the normal mucosa here in red and the Barrett's esophagus in white, showing that the mucosa of the esophagus has changed from the normal squamous cells to a colonic stomach-like epithelium. Barrett's esophagus, as you're aware, is associated with esophageal carcinoma. The treatments for gastroesophageal reflux and peptic ulcer disease involve the following medications: histamine 2 antagonists, proton pump inhibitors, antacids, physical protectors of the gastric mucosa, and prostaglandin analogs. H2 blockers include the following medications: cimetidine and ranitidine. These are commonly used today. These medications are able to suppress gastric acid secretion indirectly. They're widely used, they're over the counter, but they're not as efficacious as the proton pump inhibitors in decreasing acid secretion from the stomach. H2 blockers are generally considered very safe. They can cause GI distress, some dizziness and somnolence, particularly in the older population. It's important to remember that cimetidine is a major P450 inhibitor. It can cause drug-drug interactions. Also, any medication that decreases acid in the stomach can decrease bioavailability of certain medications, such as fluoroquinolones and ketoconazole. The next category of medications is the proton pump inhibitors. The prototype medication was omeprazole, but there are 3 or 4 of these medications now. These medications are irreversible suicide inhibitors of the potassium proton antiporter, also known as the proton pump, in the gastric parietal cell. These medications are very effective at reducing gastric acid secretion. PPIs, or proton pump inhibitors, are considered first-line therapy for patients that have bleeding peptic ulcers associated with serious GI bleed. These patients are usually put on an intravenous drip of some type of proton pump inhibitor. These medications are also very useful for severe reflux disease in patients that have a gastrinoma or Zollinger-Ellison syndrome. PPIs do have some adverse effects, however. They are generally well-tolerated drugs. They can cause diarrhea. They also can decrease bioavailability of certain medications that require acidity. There is some concern, though there is no strong data, that these medications may cause atrophic gastritis when they're used for a long time. Patients should not be on this medication for life. If a patient requires a PPI for a long time, there must be something going on in that patient, either some type of ulcerative situation that the patient needs to have addressed that's causing their symptoms, so that the cause of their symptoms should be addressed, not simply covered up with a PPI. Antacids are very commonly used medications that neutralize protons in the gut lumen. And these medications are available over the counter, and they include aluminum hydroxide, calcium carbonate, magnesium hydroxide, and sodium bicarbonate. Adverse effects of antacids include electrolyte disturbances, which can especially take place in patients that have renal failure. These patients can retain aluminum and magnesium. These medications can also decrease the bioavailability of fluoroquinolones and ketoconazole, as we talked about before. Sucralfate is a medication that's a physical protector of the gastric mucosa. If a patient has a gastric ulcer and they take sucralfate, this medication will form a gel that will line the coating of the ulcer bed and help it heal. Sucralfate, however, has the possibility of forming a constipation or a bezoar. Bezoar is a collection of indigestible material in the GI tract, and patients that take this medication too much can form these bezoars. The next category of drugs that protect the stomach are the prostaglandin analogs. The prototype of medication in this category is misoprostol. This is a prostaglandin E1 analog which protects the stomach by increasing the mucus and bicarbonate secretion by the gastric cells. This medication is used usually to prevent NSAID-induced ulcers. It's given as an adjunct in the drug called Arthrochek, along with diclofenac. Diclofenac is an NSAID-induced ulcer and is very useful in patients that have arthritis pain. Misoprostol is there to prevent ulcer formation. Here we see an endoscopic view of a gastric ulcer. This is the ulcer bed, and around it is normal gastric tissue. And inside the gastric ulcer is a tablet of aspirin that is supposed to be enteric-coated. The moral of this story is that even enteric-coated aspirins are not helpful for the stomach lining, and they can become trapped in ulcers. Helicobacter pylori is an organism, it's a bacterium that's been implicated in the cause of peptic ulcer disease. If a patient has recurrent peptic ulcers, they should be tested for Helicobacter pylori either by endoscopy or by a serum test for the antibody to the organism. Patients that test positive should undergo a triple therapy regimen to eradicate the organism. Typically, after the organism has been eradicated, their peptic ulcer disease will improve greatly. Usually, these triple therapies are involved with 2 antibiotics, for example, amoxicillin and metronidazole, plus an acid reducer, such as the PPI. There are many different formulations of triple therapy that are meant to accommodate patients of differing allergies. Here's an image of Helicobacter pylori. You can see these small organisms inside a gastric pit. This is a photomicrograph of the stomach. Here's another endoscopic view of peptic ulcer disease. This shows a gastric ulcer in this region that has a visible vessel that's bleeding. Here's a procedure that we can use endoscopically to coagulate a bleeding ulcer. We can see the blood vessel here leading into the ulcer, and it leads out of the ulcer. By thermocoagulating the ulcer bed, we're able to stop the bleeding. Usually, if a patient has severe peptic ulcer disease, this is the ultimate therapy for healing of the ulcer. This concludes our section on medications for gastroesophageal reflux disease and peptic ulcer disease. In our next session, we'll go over some other types of gastrointestinal medications.